Assalamualaikum warahmatullahi wabarakatuh. My name is HAZIQ SYAHMI MOHAMAD SUHAIMI. I want to ask you some questions. Do you smoke? Or does anybody in your family smoke? Do you know that smoke can cause lung cancer? And do you know that smoking can cause us to get other disease like nasal cancer and can speed up the death process? So with all these questions I've asked, what do you think I'll be talking about today? Please take a seat and listen because I'm going to talk about lung cancer. According to American Lung Association, lung cancer is the leading killer in both men and women. In the US in 1987, it surpassed breast cancer to become the leading cause of cancer death in women. Lung cancer can affect everybody, especially who are smoking. So, I want to give you some information about lung cancer and how to prevent it. Lung cancer is a serious disease that is preventable and curable. During this speech, I will walk you through the information on about what lung cancer is, symptoms of lung cancer, and the treatment for lung cancer. Now, let's start with the first point, which is what is lung cancer? What is lung cancer? According to the website lungcancer.org, they mention that lung cancer is the uncontrolled growth of abnormal cells in one or both lungs. These abnormal cells do not carry out the function of normal lung cells and do not develop into the healthy lung tissues. As they grow, the abnormal cells can form tumors and interfere with the functioning of the lung, which provides oxygen to the body via the blood. All cells in the body contain the genetic materials called DNA. A cancer begins with an error or mutation in cells' DNA. Researchers have found that it takes a series of mutations to create a lung cancer cell. Before becoming fully cancerous, cells can be precancerous in that they have some mutations but still function normally as lung cells. When a cell genetic mutation divides, it passes along its abnormal genes to the two new, which then divide into 4 cells with errors in their DNA, and so on. With each new mutation, the lung tissue cell becomes more mutated and may not be as effective in carrying out its function as a lung cell. At a later stage of disease, some cells may travel away from the original tumor and start growing in other parts of body. This process is called metastasis. Now you know about what is lung cancer. Let's move to the symptoms of lung cancer. It's important to report to your healthcare team if you have any of these symptoms. Often these symptoms can be attributed to other causes such as bronchitis, but you should have your doctor check anything you are experiencing that is unusual or worrisome. Symptoms of lung cancer include coughing, especially if it persists or becoming intense, pain in the chest, shoulder, or back unrelated to pain from coughing. The symptoms also can be coughing up a mucus or a combination of saliva and mucus, especially if it's thick with blood and harsh sounds with each breath. If the original lung cancer has spread, a person may feel symptoms in other places in the body. Common places for lung cancer to spread include other parts of the lungs, lymph nodes, bones, brain, liver, and adrenal glands. Other than that, loss of appetite or an eye spleen, weight loss, fatigue, general weaknesses, bone fractures not related to accident, injury, and etc. I have talked about the symptoms of lung cancer. Now let me explain how to treat lung cancer. There is 2 types of lung cancer, which is non-small cell lung cancer and small cell lung cancer. Treatment for non-small cell lung cancer is surgery, radiation, and chemotherapy. Each of these types of treatment may cause different side effects. Most stage 1 and stage 2 non-small cell lung cancers are treated with surgery to remove the tumors. For this procedure, a surgeon removes the lobe or section of the lung containing the tumor. For people with non-small cell lung tumors that can be surgically removed, evidence suggests that chemotherapy after surgery, known as adjuvant chemotherapy, might help prevent the cancer from returning. For people with stage 3, doctors recommend chemotherapy in combination with definitive high-dose radiation treatments. For stage 4, chemotherapy is the main treatment. In stage 5, radiation is used only for palliation of symptoms. Treatment for small cell lung cancer is chemotherapy and radiation therapy. Combination chemotherapy plus radiation therapy, known as etoposide plus cisplatin, which is EP, is recommended for people with limited stage small cell lung cancer. For people with extensive stage small cell lung cancer, chemotherapy alone using the EP regimen is the standard treatment. However, another regimen that may be used is carboplatin plus irinotecan. With all of this information, you should have a strong understanding of lung cancer and how to treat it. In conclusion, I hope that I have explained about my points, which is what is lung cancer, talking about symptoms of lung cancer, and giving you how to treat the lung cancer. Now that my speech has come to an end, I will conclude my speech with a quote. A non-smoking woman has greater chance of dying from lung cancer than she does of dying from breast cancer. Smoking is dangerous to everyone, especially ourselves and our family, even they didn't smoke. So if you want to stop smoking for yourself, do it for the ones you love. I think that's all from me. Assalamualaikum.